All right, there's way too many people out there paying way too much for Medicare. We're talking across the board, A, B, C, D, Medicare supplements, and all the rest of it. So we're going to go to the entire list today and make sure you're not paying too much and you're getting all the benefits you paid for all those decades you did pay into Medicare. Social Security is already at the worst staffing it's been since 1935. And they're already stressed out. Right now with the shutdown, the Social Security employees are not getting paid. Okay, let's stick to Medicare for right now. All right, so the number one ways people pay too much for Medicare is getting Medicare or not getting Medicare when they're supposed to, or when they're not, don't have to. Okay, here's the deal. When you turn 65, you're eligible for Medicare. Or if you're receiving disability, SSDI, Social Security Disability Insurance, not SSI, not the welfare-based program Social Security administers, supplemental security income, but SSDI, then you're eligible for Medicare after being on SSDI for 24 months. Okay, here's what a lot of people do, particularly the people hit 65. They go ahead and sign up for Medicare. That's fine if you don't have health insurance from work. If you have health insurance from work, current work, yours or your spouse's, and that employer has 20 or more employees, then you do not have to sign up for Medicare. You will be given what's called the SEP, Special Enrollment Period. So that basically means when you stop working, stop receiving health insurance from that work, whether it's 75, 85, 95, 105, or whatever the case may be, then you go ahead and sign up for Medicare at that time, and there's no penalties whatsoever. There's too many people signing up for Medicare when they don't have to. And you can sign up for Part A. For most people, 99.9% of people, Part A is free. Very few have to pay a premium for Part A. So some people go ahead and sign up for Part A, even though they have health insurance from work, because it covers, maybe a little bit more coverage than their work insurance. So some people do that. But B, don't waste your money on B if you don't need it, if you don't have to have it. But if you have to have it because you don't have health insurance from work, yours or your spouse's, then you have to sign up for it. And too many people are not doing it because of various reasons, and we'll get into all those here in a bit. But they don't sign up, and then they're penalized for the rest of their life. So if you don't sign up for Part B when you're supposed to, every 12 months you didn't have it, you're going to be charged a 10% penalty for the rest of your life. That's Part D as well. So this counts for Part D, the prescription drug plans. But that's not 10%. It's 1% for every month you did not sign up for Part D. And for the Part B, 10% of what? 10% of the monthly premium. So if it's $185, you're going to pay $18.50 extra every month. And then whatever it is going to be next year, you have to pay. So if you delay filing, starting your Medicare for 5 years, then you're going to get a 50% penalty for the rest of your life. Okay. So the important thing is to make sure you're supposed to sign up and you sign up when you're supposed to sign up. Okay. Another thing people do is IRMAA, Income Related Monthly Adjustment Amounts. Nice little acronym there. That started a few years ago. That's basically an extra premium people pay for Part B and Part D, the prescription drug plan, if you're a high wage earner. And it's going on based on your earnings from 2 years prior. So if your earnings, your modified adjusted gross income is at a high level, then you're going to be paying extra Part B and extra Part D premium. What people mistake is they don't fight it if they have what's called a life-changing event. If you were working 2 years ago and making a whole bunch of money, and then you stopped working, started your Medicare, and then they charge you the IRMAA, you need to fight it because you have what's called a life-changing event. Your earnings, have stopped. You stopped working, you reduced your earnings, you got divorced, you lost that income-producing property, whatever the case may be. There's other IRMAA life-changing events that might apply, and that is SSA 44 is the form. Yes, I still have all those crazy forms in my head for whatever reason. So you need to fight that one. Okay. Another way that people are paying too much for Medicare is they don't realize there's places out there that will help you with your Part B premium and everything else. And that is what's called the Medicare Savings Program. And that's a program, it's administered through Medicaid. And this is, you can't cut $1 trillion out of Medicaid and not have it hurt a lot of people. It's going to hurt a lot of people going forward. But for right now, if you or someone you know is having a hard time paying for that $185 Part B premium, then tell them to apply for Medicaid from the state, whatever your state calls it, Medi-Cal, Access, Denali Care, whatever. It's all Medicaid. Just states call it different names. Tell them apply for Medicaid, and if they're approved at the higher levels, they get the Medicare Savings Program. And so basically the state pays for the $185 Medicare Part B premium. And then a bunch of other stuff too. Depends if you're the higher levels, they cover some of the other deductibles and co-insurance and stuff like that. So it's for people, because it's Medicaid, it's for those people that are actually struggling, low income, low resources. Depends on the particular state. States do it a tad bit differently. But those budgets, those states are going to have a hard time going forward. So it's going to be difficult to get these programs. And that's basically that's the goal of all of these. That's one of the goals of all these cuts, is to make it so difficult and cut staffing by so much that it's difficult even for people that are 100% eligible. If you're 100% eligible, you think, oh, I'm eligible, I have disability, I have this, whatever. Yeah, it doesn't matter. You're still going to have to jump through a bunch of hoops, and there's going to be mistakes made because the staffing at these particular offices, Social Security, Medicaid, food stamps, and all the rest of it is super low. And that's the goal, is to disqualify as many people as possible, even if they are qualified. So that's one of the reasons we in our community here help people on a regular basis. So make sure you subscribe, like, and share, and all that stupid stuff we have to do to satisfy these algorithms. Okay, another thing you have to do is, a lot of people, they have a Medicare Advantage plan, and they said, oh, I like it. It was good to me this year. It was good to me last year. So I'll just go ahead and do nothing. Well, guess what? Your plan disappears December 31st. The company that you're with, you may like it, but the company you're with, they're going to look at your plan and they're going to rewrite it for 2026. And you might like your plan this year, or you might have liked your plan last year. That's gone. The one last, because Medicare Advantage plans are only good for 1 year. They're only good for 1 year. So you might have the same card, the same company, same doctor, same prescriptions, but a lot of the stuff under the hood, they can change it every single year. And they do change it every year to make more money. They're in it for money, right? Obviously for a profit. So it's important. These companies do not want you to review your plans every year, but smart people review their plans every year to make sure they're getting everything they're eligible for. And we've partnered with Chapter Medicare, and you can definitely reach out to them, reach out whoever you trust, and they're going to help you throughout the year. Whoever it is, reach out to them and review your current plan. Make sure your plan for next year has the providers you like, your prescriptions. Make sure you check, the milligrams, whether it's extended release, tabs, or, whatever, because it makes a big difference. Companies try everything. For the tablet, we'll charge this much, but for the other one, we'll charge, 3 times more. It's crazy, some of the stuff they try. Pharmacies, if you have a particular pharmacy you like and want to support, make sure your new plan covers that particular pharmacy. Priorities need more vision, dental, and number one is to check prices. Someone yesterday said the 7 P's are all prices. All the P's should be prices. But yeah, you need to check how much a CT scan, how much an MRA, how much an X-ray, how much it is to see a specialist. That's the hidden stuff they change every year. And persistence. I'll get into the persistence thing here in a minute. So review your plan every year. And there's plans out there, Medicare Advantage. Another way to stop paying so much for your Part B is to take advantage of these Medicare Advantage Part B give back plans. And if there's one available in your area, some places they don't have those available, but if there's one available in your area, what it does is, as the name implies, gives back part of your Part B. So you sign up for a Medicare Advantage. These are all tied to Medicare Advantage plans. I'll get to Medicare supplement plans in a bit. But these are tied to Medicare Advantage plans. So it's a Part B give back. You sign up for it, and they pay for part of your Part B, $50, $100, $185. Depends on what's available in your particular area. But be careful on those, because again, these companies are in it for a profit. If they're going to shell out $100 a month to pay for your Part B, they're going to take it out of someplace else, charge you more for this, doctors charge you more for a hospital stay or whatever the case may be. So just be careful on those. Another thing is spending too much is not taking care, not using all your benefits. We're at the end of the year here. And if you have a Medicare Advantage plan and you didn't use all your dental, vision, hearing, gym membership, whatever the case may be, then it's all going to disappear December 31st. And your plan, if you check or it automatically renews or whatever, and then there's more for next year, but that's next year. That's next year. So if you had $1,000 of dental benefits this year, that $1,000 goes away December 31st. And maybe they might give you another $1,000 or $500 next year, but that's next year. So what some people do if they have a lot of, let's say dental, they have a lot of things that need done at the dental, and the dentist says, okay, we've got a bunch of stuff. It's going to cost $4,000. What a lot of people do is says, okay, well, since I've got this money in my account until December 31st, and that's $2,000, let's go ahead and do $2,000 before the end of the year. And then if that plan has it $2,000 next year, then that's a brand new $2,000. So you maybe do your bottom part of your mouth to December before December 31st, and then you do the top after December 31st when that new money hits. So make sure you use all those benefits. And these companies are not giving you these benefits because they're super, super nice and awesome, and they get paid. Here's how Medicare Advantage plans work. All those decades you paid into Medicare and that $185 you pay every month and general taxation, all that money gets pooled and sent. Part of it is sent to whatever Medicare Advantage plan you sign up for. So if you're just the average person and general nationwide average, the government is sending your Medicare Advantage plan about $1,000 every month per member per month. If you're in a more healthy, in a cheaper area, it's $500 to $700. If you're sicker in a more expensive area, they could $2,500 a month or more. Hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter Medicare. I looked for a place that would help y'all out, and Chapter Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call and they'll see if they can help you out, and tell them Dr. Ed said hi. So that's the money that the company has as a pool to take care of people. So you're like, oh, it's zero premium, I'm not paying anything. No, you're paying $1,000 a month. Think of it that way. You're paying $1,000 a month or $1,500 a month or $2,500 a month for whatever you're getting. So get it. It's yours. You paid for it. It's not free. Nothing's free in life, right? You eventually, somehow, we paid for it, right? Somewhere, somehow. All right. What about Medigap plans? So Medigap plans, that's an important thing. As I always say, regular viewers know that when you're ready to sign up for a Medicare plan, whoever you sign up with, they're supposed to give you what's called a compliant presentation. They're supposed to tell you what Medicare is, and then they tell you all the gaps of original Medicare, and then they're supposed to say, to fill those gaps, you have two options: car, truck, dog, cat, Medicare supplement, Medicare Advantage, right? Whichever one's best for you is whatever's best for you. But all of these companies and all these insurance agents and everybody, they all make money on those zero premium Medicare Advantage plans. Why? I just showed you why. That, right? So the Medicare supplement plans, don't make as much money for these people, but it's better for people, particular people, if you can afford it, because there is a monthly premium for those G, N, F. If you were eligible for Medicare before January 1st, 2020, then you're still eligible for an F. So if you can afford it and you don't want to deal with networks, HMOs and PPOs, you don't want to deal with prior authorizations, which I'll get to here in a second, then you get a Medicare supplement, Medigap, same thing, F, G, N, usually a G or N nowadays if you're new to Medicare. And if you're sick, you're like, well, I could get a zero premium plan with Medicare Advantage, or I can get a Medicare supplement plan. And if you really come down to the sickness and you start using that, you're actually going to save money with a Medicare supplement plan, because you could have $1 million of charges for whatever therapy you have, and all you pay is $257 deductible if you have a plan G. and obviously the monthly premium. But if you have a Medicare supplement, then you have to go to prior authorizations and, limited networks, and then they nickel and dime you. And so it really depends on your situation. Nobody can tell you without asking you a bunch of questions whether a Medicare supplement or Medicare Advantage is best for you. And if you have one of those, you can shop every year, every day of every year, you can shop. It really depends on the state you're in and whether you're healthy, if you can pass health underwriting. So if you're healthy and if you have a plan G and it's costing you a bunch, you can, any time of the year, you can call and say, yeah, I want to see if I can switch to a cheaper G, because a G is a G is a G is a G. And ends and ends and ends and ends. They're all, pretty much the same. The only difference is price. So see if you can get into a cheaper G or an N or F or whatever the case may be. Shop it. Again, you might have to go through health underwriting, which is they just ask you about 30, 40 questions. If you want, call Chapter and say, hey, I'm healthy. Can I save any money? Is there a plan in my state that's cheaper than what I'm paying right now? They'll check it out. And yeah, if not, then at least you're not wasting your money. All right. The other thing that people, if you have a Medicare Advantage plan, remember prior authorizations. So if the doctor says you need something, it doesn't matter. They have to go through the for-profit health insurance company, and they second guess your doctor. And if they deny you, what a lot of people is they don't fight. They don't appeal those decisions. They just say, hey, okay, I guess I'm denied. So I guess that's the only thing I can do. So the important thing is to fight. And on my website, mygovexpert.com, you can click on the more button there, click on appeals. And this is all, my website is free. And it tells you all of the different appeals. So if you're denied disability or retirement or survivor benefits, that's a way to appeal. But you go down there if you're denied for original Medicare, which, if it's medically necessary, then you get approved. But Medicare Advantage plans, they all do it a little bit different, but here's kind of a detail of all the ways you can fight your Medicare Advantage plans. And people don't realize that you can also fight formulary. So if you have a prescription and you like this particular brand and your Medicare Advantage plan or Part D plan doesn't have it, you can fight that. If it charges you too much, you can appeal that. You can fight that. So people just don't fight enough. We need to appeal, because that is, that's the new MO going forward, is to say we cover X, Y, Z, B, whatever. But then when it actually, the rubber hits the road, they make it as difficult as possible and people give up. And that's what they're doing with Social Security. And I've got another story that just came out about Social Security employees, that they're just, it's terrible there. And I've already known this. So my community's already known this. All right. So that is how you make sure you save as much money from your Medicare Advantage. And that's one of the things that Chapter does. And full disclosure, they support this channel, support the websites that we have, the free websites that we've got up there, and all the help that we help people with Medicare, Social Security, retirement benefits, survivor benefits, disability, and all the rest of it. So you give them a call. You can review your plan, your Medicare Advantage plan, from October 15th to December 7th. Chapter is kind of crazy busy right now. You should be able to get in. A lot of people want to get in because of the help they provide. They provide outstanding help. I would argue the best in the country for after the fact, because anybody can sign you up for a Medicare supplement plan or Medicare Advantage plan. But it's the customer service after is why my son and I chose Chapter Medicare. So if you have an issue in February, March, April, May, June, July, whenever you're denied, they help you fight the prior authorization. If you lose your doctor, they help you find another one. If you need to fight something on your prescriptions, they help you do that. They help you navigate the bureaucracy, just like we do here with all things Social Security and Medicaid. So give them a call, and they can see if they can help you out. Okay, let's get into some questions, and also we'll jump around from questions. Let's see, Bonnie, I reviewed mine with Chapter. They said mine was the best I could get. Staying with it. There you go. Yep, and peace of mind. At least you're good for the next year. And next year, on October 15th or so, you give them a call again and say, okay, 2027, is it still the best? And if they say it's still the best, then yep. So perfect. Awesome. Good deal. Yeah, peace of mind there, right? Janice, for the last 2 years, mistakes were made by recertification with Michigan Health and Human Services for food stamps and spin down, saying I made 8,000 more than I make on Social Security. Wow, that's quite a mistake. And again, that's the goal, is to make as many mistakes as possible. And how do they make an organization make as many mistakes as possible, where they make it so complicated and then they don't provide actual human beings to help you navigate the system? It's like Social Security. That's what they're doing with Social Security. Even though you paid all those decades, you paid into FICA for Social Security, that money went to your retirement or disability or survivors or Medicare, whatever the case may be. But also a very, very, very small percent of it went to assistance when you needed help. So you paid for that help. It's like, calling up a plumber and then paying ahead of time. Says, okay, you're going to come fix my thing? Okay, I'll go ahead and wire you $500 right now. And then the plumber never shows up. Would you be torqued? Yes. But that's the goal. That's the goal of the politicians who are trying to undermine and destroy, Social Security. So let's see here. Thank you to Weir Magazine Help. You're welcome. You are amazing, because y'all go out there and take this information and help all those people around you.